What's up, y'all? So for this video, I'm going to talk about as far as for working in the OBGYN medical assistant field and just things that I kind of noticed that makes me kind of want to have kids. So y'all, I am 28 years old. I have no kids. I'm a perfect auntie and godmother. Um, all of that. And pretty much like when working OBGYN, one, you work with a lot of pregnant patients. So that already pretty much put you in a mindset where it's like, oh my gosh, like you're constantly seeing people come in from different ages and they're all getting pregnant, different ages, different sizes, different races and everything like that. So I feel like that's one thing that's amazing. Also, too, one thing that I like with my job is that you will literally see them like with their stomach flat to their stomach getting real big to them bringing their baby for their 2-week postpartum or their 6-week postpartum. Not only that, in our office we have like where there's pictures of the mom and the baby after pretty much she done gave birth and stuff like that. So it gives you baby fever a lot. I did want to make like a little conversation that I just kind of want to talk about. So I feel like a lot of people on TikTok are talking about like how it's wrong to have kids in like their 20s. Some people saying wait till like their mid 30s to have kids. And me personally, I do not want to have my first child at 30 years old. I would love to have my first child before I'm 30. It's just working OBGYN. I literally seen like there's certain risk factors that can make you high risk when you're waiting too late to have kids. Granted, don't get me wrong, a lot of people want to enjoy their 20s. A lot of people feel like they don't want to have kids until they're married, or all types of things that come along with it. But me personally, I really feel like, one, I don't want to have one when I'm 30 because, one, like I said, it's you're more prone to being high risk. When you have a child and you're 35 or higher, you're automatically high risk. Also, too, your BMI matters. If you have a BMI, which is your body mass index, if you have a BMI over 30, you're automatically high risk as well too, because they're categorizing you as being obese. So your age, your weight, also too, if you had histories of miscarriages, like multiple miscarriages, not just one, but if you have multiple miscarriages, that make you high risk. If you have multiple C-sections, if you had any history of smoking while being pregnant, or because most people do that, they smoke while they're pregnant, or any history of smoking tobacco, any history of smoking weed, anything like that. Certain medications people take can make them high risk. It's a lot of factors that make you high risk, but the main thing that stands out to me is the age. And been working here, I have noticed that there has been plenty of people who first child is in 40 years old. Sometimes it's starting to get closer to 50, you know what I'm saying? So anything is possible, but me personally, I just don't want to be that percentage of people where I have to go through that. Not only that, I noticed that when you have a child and you're 35 or older, it can get you prone to having Down syndrome within your baby as well too. So I noticed that as well too. So I just really feel like not like maybe late 20s, I feel like it's okay as far as for your kids. Me personally, I'm not everybody, but I would like to have a child either where I'm 28 or 29, my first child, just at least try to have one out the way. But as far as for 30 or more, you're prone to being more high risk. And don't get me wrong, there are plenty of women who have babies and they are high risk and their baby is completely fine. Don't get me wrong, there is plenty of people like that. But I'm already looking at myself right now, like I'm a thicker woman, so my BMI is definitely over 30. And I really feel like that's the main thing that'll just make me high risk as far as for that. And then also too, when you are high risk, sometimes if the midwife can't take care of you, she'll have to, or he will have to transfer you over to someone else who can possibly take care of you. And if you are a certain high risk, they'll send you to certain hospitals or clinics that can make sure they only take care of you. Also too, having STDs and stuff like that can make you high risk. It all just depends on the situation that you have going on with your body. Some people are born with different um different conditions and stuff like that. So I just really feel like I kind of wanted to make this video on it because I feel like a lot of people, they're wanting to have kids just to make sure that they're always stable, and which is understandable. You do want to be stable, but I feel like I'm in a point in my life where I feel like everything is not going to always be perfect when you have kids. But I do know I don't want to be too high risk when it does come to me having kids. I don't mind my weight being one thing, but my age too, and all this extra stuff, being anemic and all this other stuff. Like, I just feel like that's a lot to take in. So comment below and let me know what y'all think about it.